Hey guys, welcome back to yourstory.com. We're coming to you live from Taj Yashwantpur in Bengaluru. I've got Adrit Raha, the founder of Vivant. How are you?
Yeah, very good. Thank you, Vishal.
It's exciting Tsparks, isn't it?
Indeed. It's been pretty exciting the last day and a half.
I'm very happy that you've flown all the way from Singapore for this. Thank you very much. Vivant, guys, is a health tech platform. They've got more than 50 customers, is it?
We've got about 50 enterprise customers, over a million users on the platform.
I would suggest you to use that platform simply because it can change the lives of your employees. And Adrit, tell us how.
Yes, of course. We're basically a data-driven healthcare platform that powers the entire ecosystem, right? And I think aspirationally, we want to be the Intel inside of healthcare. And what I mean by that is we've got three core segments that we work with, insurers, corporates, and the healthcare ecosystem. And really, it's about enabling them to offer various
Better
aspects
services.
absolutely better services, various aspects of healthcare to their end user, which is either a customer or an employee.
Think about it, guys. You plug into that platform, and you get to know what your employee is leading your life, right?
That's
I mean,
right.
you know what he's doing.
That's right.
In terms of fitness, he or she.
Yeah.
You can actually intervene to help them lead a better life.
Absolutely. And that is the key.
Is that simple as that?
It is as simple as that. And
Why
it is
hasn't
the biggest
the world done it?
Well, it is the biggest challenge too, right?
Why?
If you think about it, and if you think about your own life, and perhaps if I think and reflect on mine, habit formation in the world of taking your own health into your own hands is the biggest problem. We don't do it because we don't believe there's a problem today.
I agree with you. I wake up every day telling my wife that I don't eat rice today, but I end up eating it anyway.
Absolutely.
So habit formation is difficult.
Very difficult.
So,
Very difficult.
you've got a lot of corporate customers. I want to understand when you signed up with the first few of them with this idea, did they laugh at you?
Yeah, well, I think some saw a need, some wanted to experiment, and of course they saw different value from the different segments, right? So insurance companies like us, because ultimately there is an end play of trying to reduce claims cost for the insurers, right? Engage their customers better, retain their customers better. You've got the enterprise corporates that say, hey, am I able to keep my workplace safer, healthier, happier, and then therefore more engaged and better retention. And then you've got the healthcare ecosystem that goes, hey, I've never ever offered a front-end tech platform where reports are digitized. You're able to access data in a friendly manner. Today, one of the fundamental issues, if you look at the healthcare ecosystem, is you get a report, but the report is designed for doctor consumption.
Yes.
Nowhere in the world is there a report that's designed for patient consumption. And that's what we're trying to influence and impact.
And the impact is what? I mean, obviously I spoke about better livelihood.
Yeah, better livelihood.
But it's also the fact that you take control of your data, right?
That's right.
And this data is used by insurance companies in any way.
Absolutely, and that is the key play. So that's why we're B2B, right? So there's an obvious impact to that end customer, which is how do I make you live a healthier life? But really, we are a B2B play, and as a B2B partner, we want to be the data connectivity, which allows the payer, the provider, or the customer to have access to the right data at the right time, and then use that to really make better decisions.
Okay, I sign up with you.
That's right.
As an individual and as a company.
Yeah.
And you usually sell to the HR teams or the CEO teams?
It depends. So it's varied, the model. So HR is a definite recipient to the product for corporate wellness. The CEOs and the product leads are the recipients from an insurance perspective, and the CEOs typically from a healthcare ecosystem.
Okay, and once we sign up, how does the product work?
So we would go in there, and because our technology is very modular and we have the capability to co-create, we would actually sit down and ensure we understand the pain points of that customer. And we would then offer up the product in the avatar that would make sense for that customer.
So you white label it for them too?
Absolutely. We would co-brand or white label the product. We would be able to integrate into their ecosystem if they have anything, so that we don't disrupt the existing customer journey or perhaps customer experience. And then we would overlay that with exactly the features they need.
And the assessments happen right from day one that I sign up?
The assessments can happen from day one. We have, the three core components of the product is to allow someone to identify their health issues, track it, and then subsequently manage it. And identification is a combination of questionnaires, clinical data, facilitation of the checkups, all of that.
And most of them live in denial, the employees. They think they're fine, hey, I've got a group insurance, right? But that's not done, right?
No, absolutely.
You're a proactive platform.
And that's the intent. So the entire artificial intelligence, machine learning engagement engine is what's key and core to what we do, which is how do I go back and talk to you, right, without really disturbing you.
Now, how does that happen? I mean, it's intrusive. The questions are designed by the corporate themselves to
No, so it's
understand
it's
the employee?
intuitive, the platform itself, and the questions can be designed. So that's the flexibility of the platform. But there is an automated engagement engine, which is basically taking your behavior on the app and your profile that you have inputted or we've obtained from clinical records, and then the app kicks in and starts talking to you about what are the things you should be reading, the tips and the tools that we would sort of share.
So
with
there's
you.
also a lot of content.
Absolutely, we have about 800 pages of self-curated content on that product.
And so you're a services arm, you're a product arm,
That's
and a content.
So I'm a product
completely.
arm, right? I
Yes.
have the product where I'm able to curate a few things for
Completely,
you as a
yes.
business, and then I have content that feeds you in terms of keeping you aware of what the issues are.
One of I don't want to mention names because they have an NDA with all their clients.
Right.
These 50 corporate clients are Indian.
Yes, primarily. So we've just started expanding outside India. We're looking at Singapore, Indonesia, and Malaysia. We've had a couple of clients sign up in both Singapore and Malaysia.
So
but
will it
primarily
be the same product? Similar?
absolutely the same product.
So the world has the same problems in terms
The world
of
has the same problems,
yes.
and if you look at Southeast Asia and India specifically,
I would think they're so much more proactive, but they're not, no?
yeah. So you've got very common habits in terms of I should be careful what I say, but eating unhealthy, I guess, right?
We
So-
do. I mean, I'll be honest about that. I mean,
Yeah.
tell me about it. We do
Yeah.
eat unhealthy.
Of course we do,
Yes.
and it's a factor of a lot of things. It's a factor of the lifestyle we lead. I mean, we're busy with work, we're busy with family. We don't get time to discipline ourselves, and then there's culture.
It's nice to have a corporate finally nudging you to be healthy.
Absolutely.
Guys, then you can stop complaining that my company doesn't take care of me.
Absolutely, absolutely.
So is that a global problem? I didn't know that. I thought it was an
big
Indian
issue.
thing, though.
Not at all. It's a big issue globally, and I mean, corporates today spend 90% of their budget towards an insurance product, a group product. I mean, very little is allocated towards health and wellness, and this is really why I think it's an important area.
It's amazing. It's like an IoT for cars. It's an IoT for people.
People,
now, right?
absolutely.
And so there are dashboards that people look at.
That's right. So the entire app is on your phone. You get access to sort of how you're doing. But what's also important is the business, whether it's the corporate or the insurance company or perhaps the healthcare ecosystem, will get real-time data and will be able to understand health trends of their population immediately.
So they would get my individual data. The CEO's team looks at it individually, or is it?
So it depends on the industry. Now, obviously, in the corporate world, individual health data is not made available to HRs because it's not allowed.
It's not allowed.
But
yes.
the CMOs, which are the medical officers, are allowed to see that as an example.
Oh, so that's a new role altogether.
right.
Yeah, I thought you were going to say chief marketing officer,
No.
but it's a chief medical
Medical
officer.
officer.
So you're creating a whole new title there.
Well, in the occupational health space in India, there's by law required to be, occupational health centers.
So
and
if I'm a
medical
1,000
officers.
member corporate, I need to have a medical officer.
Well, I don't know the details of the numbers,
Okay.
but I believe you're right. It's about that, and it's also about the industry you're in.
That's interesting. So the CMO can get to access it, and then
That's
he
right.
can probably advise you better.
Absolutely, and intervene, and then hopefully help you.
And the data protection here, because you're expanding globally, there's a lot of data laws. Each country has
That's
its
right.
own.
That's right.
I mean, you're a cloud company in the end of the day.
Absolutely.
Is the data sitting in India?
So today we have the servers hosted on Microsoft Azure, which is in India, but
Amazing.
it allows us to move
Port
it
it anywhere.
Absolutely, right? And that's the beauty of what we do.
So you're going to make sure that every geography is going to have its own cloud.
Well, it depends on what the local requirements are, right?
Yes.
I think coming from the insurance world, I've run a couple of programs where data on soil is important. In some cases, data on soil is flexible. So I think we will have to be cognizant of which countries we start expanding.
Okay, talk about the first few days of you worked in insurance. The
That's
first few days here, you got the idea, you quit your job.
Right.
How difficult is it? Because most of our
Yeah.
audience are 18 to 35, first-time entrepreneurs.
Yeah.
How did you manage it?
Yeah, I mean, I think the biggest challenge is yourself. I think you've got to be prepared for the fact that your life's going to change dramatically. You've got to embrace it. You've got to be ready for it, and then just dive in. I think there's no other way.
So that's how you started?
Absolutely.
Wow.
Yeah.
Wow. Do you remember your first 10 days or month where was it about fundraising at the time, or let's get the product going, or what was it?
No, so no fundraising at all. I think the first 10 days probably, and I would say the first year, which has been 1st of October this year now, the entire thing is just whizzed by.
Yeah.
And it's been insane. I think there's been no time to breathe.
It is insane. I mean, how do you manage your sanity is a question. I mean, how do you do that?
Yeah, I'm still trying to figure it out. I think I'm fortunate. I've got 2 young kids at home,
Okay.
and I try and get away and breathe at times when I'm with
So
them.
would you suggest that you need to have good sleep too as an entrepreneur?
Without a doubt, I think you can't not balance your life while working. I think it's good to put in the hours as you need to, and you must.
Okay.
But the balance is important.
Any selling tips that you'd want to give to young entrepreneurs? How do you sell to corporate?
Well, yeah, I think fundamentally understand what their problems are. I think if you put yourself in the shoes of the corporates, you put yourself in the shoes of anybody else, understand what their concerns are, and if you're able to find a solution for that, I think that's an easy way to sell a
You know, there's another product that I forgot to bring in the picture. You've got Naira,
That's right.
which is the B2c Experiment,
That's right.
right? And Naira is a fertility tracker for women and also men, right? You want to talk about the platform a bit before we close the show?
Yeah. So Naira was an interesting experience. So again, the nimbleness of the journey is one of the things I'll highlight, which is it took us between 4 to 6 weeks to launch a product like Naira, which I think is really cool. The product itself is now available in 4 different languages and can be in a new language in a few days. Naira is basically a period, fertility, and a premenopausal tracker. And what it does is it allows women from as early as perhaps 10 to 13 years old, all the way through to your premenopause phase, which is between anywhere in the 40s and 50s, to really be able to track and understand their cycle. The 2 unique features that we offer up right now, which no other period tracker or fertility tracker in the world does. One is we're, as I said, multilingual, and the second is we have a free doctor chat functionality.
And the app, it's called Dr. Chat itself.
Well, it's just a doctor chat on the app, and when you're on the app, you can click on a button.
It's a real doctor.
It's a real doctor.
It's
that
not
you
an
speak to.
AI engine. That's
No.
Okay.
So we will be introducing and enhancing the product with AI-led chatbots, but that'll never take away from an actual physical doctor interaction.
How does it help the women? I mean, fertility is a big thing, and most of them want to be mums, so they get to. And many of them have thanked you.
So it's been unique. We've been alive. We've been around for 4 months. We've had probably about 200,000 downloads, 2 lakh downloads without much marketing intervention. Of that, we've had 30,000 chats.
Okay, and what are the typical questions that I want to know? I missed my cycle.
Yeah, so a lot of it is to do with your menstrual cycle. A lot of it is to do with wanting to get pregnant.
Okay,
that's what we are seeing. And interestingly, as you rightly mentioned, we've had about 4 individuals that have come back and thanked us and said thank you for the interaction. It's because of you I've actually gotten pregnant.
And you also help because you help people talk about polycystic ovaries.
That's right.
Which is why most of the women don't have babies also, right?
Yeah.
Do you want to talk about that?
Yeah, so I think PCOD or PCOS is just one of the many I think increasing concerns with women today. What Naira does, and I think if you just take a step back and think about the doctor chat capability, I think it's a combination of the tabooed environment.
Yeah, mostly you go to a mother-in-law or a mom, and then they might not be happy with the answer. They might not have information.
That's right. So there's a combination of lack of awareness, lack of information, but then there's also the entire cultural ecosystem that doesn't allow you to go talk to doctors and people that easily. And I think what this allows you to do is actually be very free and ask the right questions and get the right response from a qualified professional.
Interesting, and guys, please go download Naira.
Yes,
right. Even if you're a man, you can download Naira.
Absolutely, right? track your partner's cycle.
And that'd be very we are suggesting it because you're going to be more proactive that way.
That's right.
It'll enable your partner to be relaxed. Yep. Most of the women need that support when they're getting pregnant, right?
Yeah.
And if you're a corporate, sign up with Vivant.
That's right.
And what does Vivant mean?
Vivant comes from the word life.
Okay.
So that's
Sanskrit?
Yes, that's right.
Interesting. And listen, Adrit, it's been an absolute pleasure.
Yeah.
Look forward to your success.
Thank you very much.
I look forward to meeting you at the Yourstory office soon.
Look forward to that as well. Thank you very much.
So guys, listen, if you haven't made it to Tsparks, check us out on Facebook. All the stories are there, guys. Thank you. Bye.
Thanks. Bye-bye.
Bye-bye. That's good. So what have you been reading? You've been reading, you get time to read?
I don't